So there's no such thing as a good injury, but this one I think is actually a pretty bad one for hockey goalies because it really impacts, how you go into the butterfly. Just you feel nervous about it, and it does take quite a while to heal, so you have to be patient with it. So we're going to go over the mechanism of an MCL strains, and then we're going to head back into the gym and talk about some things you can do while you're recovering from an MCL strain to help retrain your body, that it's okay that you can move in those ways, and even to reassure yourself like, hey, I can do this and it feels okay. So let's start with what it is. So the MCL is, I'll show you in this one, it's a ligament that's sort of on the inside of your knee, and it goes from your tibia to your femur, and so it's a ligament. Because it's a ligament, then we say that it's a strain, not a sprain. So what happens usually, your leg is outstretched, somebody falls on you, that can do it. You can sort of do it yourself, falling backwards, kind of sitting back on your foot, falling backwards on your knee, that can put enough torque. Or if you're back in that position and someone lands on you, it's pretty hard to do just going into the butterfly, but probably if you're scrambling and you just go into it really awkwardly, perhaps you could, but that's what it is, that's how it happens. Now let's go back into the gym and sort of figure out what the heck we're going to do about it. It's the dreaded MCL strain.
It's the dreaded MCL strain.
Hey, this is Maria from goalietrainingpro.com. I am an exercise physiologist who helps you do the right training off the ice so you can stop more pucks on the ice. Today we're actually talking about what to do if you've strained your MCL. So let's first chat a bit about what it is, and then we'll talk about the steps you should take from the moment you sort of tweak it to the moment that you get back onto the ice. The MCL is a ligament, and it's in your knee. So it is, the MCL stands for the medial collateral ligament. So it goes basically from your tibia to your femur on the inside aspect of your knee. So it sits right in there. And in order to damage it, there has to be some mechanism of what's called a valgus stress on your knee. So there has to be sort of forced into this position with your knee. In football, it's really common, a running back's running the ball, plants his leg, a guy comes and tackles him from the outside, drives his knee in, boom, that'll tear the MCL. In hockey, it's more, for a goalie, it's more common that you might do something very awkward going into your butterfly, or you might have somebody fall on your leg that's sort of in an outstretched position. Those are the two most common mechanisms. Or like you're in your butterfly and you fall backwards on yourself, or someone falls on you that way. That can tear it. So if it's one of those mechanisms and you're feeling pain in here, it could be an MCL strain. Because an MCL is a ligament, it is a sprain, not a strain. So you sprain ligaments, you strain muscles. So that would be a ligament sprain. So if you have one of those mechanisms, you're feeling pain in here, then your best step is to phone a good sport physical therapist. Now I know some of you have to go through your primary care doctor to get to a good sport physical therapist. That's fine, but they are really the best ones to assess, get their hands on, assess that grade. If you have a primary care doctor who's also like a sport medicine primary care, they'll have pretty good skills too. But a lot of times, if you just go to your family doctor, they'll say, well, you've sprained your knee, take a couple weeks off, rest it up, and see if it feels better. And like we talk about all the time, almost anything feels better if you take some anti-inflammatories and don't do anything for a couple weeks. But then it doesn't sort of fix the problem. Then you go back and you're going to get the pain again, or you might even damage it more. So call to the sport physical therapist or a sport medicine doctor to get it assessed. And really you shouldn't need, like right off the hop, like an MRI or something like that. A good therapist can assess what grade it is, and then it's going to be grade 1, 2, or 3. A grade 1 means, yeah, you've sprained it. There's probably some fiber disruption, but on palpation you don't feel, they can't feel sort of a gap in there. There isn't really a big loss in stability in the knee, so that's like a minor strain, or a sprain. That's like, phew, good news. A grade 2 means, yeah, there's actually like a tear in the fibers. There's a gap that they may or may not be able to palpate, and there is some instability in that knee. A grade 3 is that's completely torn, and that can be a pretty big problem for a goalie. So grade 1 or grade 2, rehab. Grade 3 is going to be rehab, but it's not a good injury for a goalie. Not to say it's career ending, but it's going to be a long road to recovery. When you get home, I still am going to say ice it, and I know there has been some stuff that ice is actually bad, but I still think it helps. Even when I worked in the sport medicine clinic, like when we ice things, the swelling seemed to go down. So if it was me, I would ice it. If you have a different belief, that's totally cool. Go with what you feel works best for you. But I would ice it, I would elevate it, and I would rest it until I can get it checked out. What you don't want to do is go back on the ice the next day just to test it out and see how it feels, because you're going to probably go into your first or second butterfly and feel a world of hurt and probably do some more damage. One thing to keep in mind, anytime you sprain or strain, I guess I'll talk about spraining a ligament in a joint or have damage to a joint and swelling around a joint, is that changes the proprioceptive awareness of that joint. Even if they just injected saline into your knee joint, that throws off a little bit your body's perception of how the joint is oriented in space, how much tension is on the joint. Really important information that your nervous system sends to your brain about your body's position in space. So it's always more risk to play on a joint that is swollen. What do we do next? So the first tasks once you get to physical therapy are going to be, number 1, reduce swelling. Number 2, restore full range of motion. Number 3, get some muscle activation, because sometimes when we damage a tissue around our knee or a joint, the muscles above and below can kind of get turned off because our body's trying to say, well, hey, we don't really want you moving that knee, so if we kind of shut down these muscles, then it's going to be harder for you to move that and to do things that you want to do. You're going to be kind of forced to rest. So we want to get that muscle activation back. And then, when there's no pain on weight bearing, we're going to start working on some proprioception. So getting the swelling out, I still use ice. I think you could use a compression bandage. Getting full range of motion back, we would just do things like, sliding, or even if my foot was on like a smooth floor, just sliding it up, sliding it back down, trying to get as much range as you can, but in a pain-free way. So I'm not going to be, forcing it. Now, if you're not getting the range back after that acute injury phase, then, you or the physical therapist are going to have to start giving it some juice, because you need to get full range. But in the initial stages, you want it to be pain-free, and don't ignore straightening. So straightening is really important too. For the MCL, pretty much as soon as that swelling's out, you're going to get your full range of motion back. It's not going to be too hard to do that. For muscle activation, we want to make sure we're activating the quads, getting the adductors going. So we would do quads over a roll. We would get like a little foam roll. You could use anything, a pillow, but just getting here, straightening, and then, making that muscle tight, like consciously thinking about squeezing those quadriceps to get them firing. You'd hold for 3 to 5 seconds and relax and do sets of 10 to 15. If we want to get our adductors going, we can just do sideline adduction. So getting this leg straight, this leg is bent up in front of me if this is the injured side, and then just a little lift and down, a little lift and down. And that's actually even going to put a little gentle strain, or stress I should say, through that MCL. So as long as it's pain-free, or it doesn't increase your baseline resting discomfort, then it's okay to do that as well. Because one of the things that is well, I'll say so cool. Getting injured is never so cool, but one of the things that's so cool about the human body is it knows how we're moving and what the line of force and the line of pull is on these different structures. So when I have an injury, if I can gently give that tissue and a sense of, hey, this is the kind of force that you're going to be put under, then as the scar tissue is laying down, as our body's repairing and rebuilding that area, it's going to learn like, oh, okay, well, these fibers, we need to kind of lay them down along sort of this way, because that's how the knee is going to be put under force. If we just rested and do nothing at all, then it just knows like, oh, we got to fix this, and it can kind of make like a knot of scar tissue that then is going to be quite stiff. Whereas we'd rather, have it lay down sort of along the lines of pull so that it's a little bit more useful for us. So once you have, your range of motion pretty much restored, your swelling is down, you've done a little bit of muscle activation, you can stand and it's not painful, then you'll start working on some proprioception. So in that ligament, there are some little joint receptors that have been damaged, and it's not something you're aware of, that you feel those working, but they send really important information to your brain that helps you do sort of micro adjustments to maintain your balance and stability and try to keep that knee in a good position. So we start very simply just with single leg balance, and you might be surprised when you do it on the side that's been injured compared to the side that hasn't been injured. You'll probably notice quite a dramatic deficit. Now it will come back. It's just a matter of your body retraining and relearning. The next step would be to do that single leg balance with one eye closed. And when you can do that for 30 seconds without a problem, then the next step would be to do it with both eyes closed. But again, you want to make sure that your rehab is progressed enough so that if you're here and you lose your balance and you need to step like that, you're not going to cause yourself pain or discomfort or give yourself another tweak. This would also be, if possible, an ideal time to get into the swimming pool, because you can start doing some early rehab in a pool. This is actually what I did my master's thesis on, in a pool while you're still healing, and you can do things you couldn't do like weight bearing in the physio gym, but still get some really good benefits and retraining. So let me kind of walk you through. I don't have a pool right here, obviously, but let me walk you through kind of the types of things that we would do. Initially, you would start out in the deep end, and we used to just get like a pool noodle and put it under people's armpits, and then they would do like deep water running. So your head is out of the water, you have a pool noodle that's helping you float, and then you're just really cycling both your legs. I can't really do it right here because I'm not hanging, but cycling, almost making more of a cycling motion with your legs in the deep water, and you will move a little bit as you go through that. You could also start adding, from that hanging position in the deep water, some frontal plane scissors. So, with both your legs at the same time going out and in, almost like a jumping jack, but not as fast. So the thing with pool training is the faster you go, the more resistance you're going to get. So you don't want to jump in there and start cranking frontal plane scissors, because it's going to put a lot of strain on your MCL. But just start like we did on the floor, giving that those tissues a little bit of an idea. Oh, this is the line of pull. This is where we need to be stronger. So deep water running, some frontal plane scissors. From then you could move into some shallower water, maybe chest deep. The lower the water, the more load is going to be on your legs. So if you start just chest deep and really just starting side step, side step, side step, side step as you go, that's a great start, because there is going to be some tension on the inside of your knees. You can start incorporating squat patterns, just neutral stance. You can work into your split squat pattern. You can work into a squat lateral pattern, then a little bit of a lunge lateral pattern, a little bit of a lunge forward. Remember, you're still in water that's about chest deep. When all of that is pain-free, then you can add a little more dynamic work, maybe a little squat drop to pop up, just to get your body learning to move with some of those quicker patterns, but unloaded by the water. And there are a bunch of other exercises we can do, but those are some that will get you started. And then we can start moving more of your rehab sort of out of the pool, onto land. Here's a few things that we would work on there. So we could start with some isometric. So if we just get kind of in our half groin position here, you know, just getting out in this position, and there's going to be a little bit of tension there. We could then use our muscles to push down a little bit. And again, feel some tension in our adductors and a little bit on the inside of that knee, not to the point of discomfort, but so that we see, okay, well, yeah, what's our load tolerance there? How much can I push without that being uncomfortable? It's a good static position. Don't overdo it, but that's a nice place to start. And then I also like moving into a tall upright position to get the same stretch, because I find it's a little more functional for what you need to do on the ice. Once that is feeling good, you can, do sort of 10 seconds on, 5 seconds off, isometric tension, building pretty good tension, not having any pain during or after. Then you would move into a little bit more progressive, eccentric to concentric. Let me get a little glider. I use my slide board to do this, but I'll just show you with a glider, because maybe you have something like that at home. So this is just a glider. It's just smooth. You could, if you have like a smooth floor anywhere in your house, just do this in your socked feet. If you have turf or carpet, then you can even just put your foot in a frisbee or in a plastic bag or whatever. But you're going to start here, and you're going to slide out, not as far as you can, just till, okay, I'm just starting to feel some tension. Then I'll pull myself back up. Out, pull myself back up. So we're sort of building a little tension there, and then coming back up to our starting point. So what we're really doing is kind of turning on our adductors that will integrate with that MCL. The fascia, the connective tissue, will integrate. So we're really kind of working that whole chain of tissue. We can put a little more direct stress in that butterfly position, just coming into our supine hip internal rotation. So feet a little wider than hip width, and then pinching them in together. Again, not forcing it, not pushing as hard as we can, just adding a little bit of overpressure. From that position, I also like to move up into a half kneeling position, almost, thinking about coming down into a butterfly or an RVH, but I'm in this half kneeling position, and then I just drop this knee in a little bit, come back up. Not forcing it, not feeling any discomfort. I'm just trying to get at it from different angles, so that also my brain is learning, oh, that's okay. That doesn't do me any harm. I'm good to do that. And everybody's different, but sometimes following an injury, some athletes will be like, boom, like, let's go, and they never think of it again. Some athletes just feel nervous. They feel nervous it's going to happen again, or that it's not strong enough, or that they're not ready. So doing these kinds of movement patterns too, all the way along, is helping to just build your confidence. And I think that feeling like, oh, I'm nervous about this, is actually your brain trying to tell you, like, yeah, I don't know if this is going to be okay or not. So I think the more we can do during your rehab to help your brain understand, no, this is fine, this feels good, we've done this before and it was okay, really helps take away that apprehension when you are going to return to the ice. All of these are dependent on competency, on feeling fine with it. If something's giving you pain or doesn't feel right, then we don't move on to the next level. We only move on to the next level when we've achieve this level goal, then we move up. So this one is fairly advanced. So I've got my foot on the floor, on the wall, I'm in hip internal rotation, almost like an RVH. And then what I'm trying to do is I can push my foot into the wall a little bit, which is going to put more strain on my MCL. I can also try to lift my foot away from the wall by going into more internal rotation. So I'm working both those movements into the wall and away from the wall in this pseudo RVH position. If all of that is progressing fine, then I would go into an assisted butterfly. So I have a pretty heavy super band here. It's probably 1.5 inches super band. I've got my AirX pad. Probably if I had 2 AirX pads, I would lay them up, or if I had a Bosu, I would kind of kneel till my knees hit the top of that Bosu. But for now, and it's just, I'd be coming down, not into a wide butterfly, but just gradually adding that pattern. And then you could slowly, as long as it's feeling fine, make it wider and wider. So you can see how the bungee is really helping to take the load off. I'm not falling down in there. It's just kind of lowering me and I'm coming back up. I could even use my hands, you know, to come back up if I wanted to start with just the eccentric portion. From there, the next level would be coming into that RVH, using the band to help, not starting with a really wide RVH, but just nice and easy and controlled. We're just, you know, we're just trying to like stick our toe in the water. Hey, does this movement feel okay? Is this giving me pain, or is this something that, yeah, that feels really good. So some of you are thinking like, wow, that's a lot of stuff. Like I just take a couple of weeks off and then go back and test it out. I've seen more athletes end up back in physical therapy because they just thought they'd go and test it out, you know, than almost anything. So resist that temptation, because this is how you should return to the ice. And if you're really serious about not having this injury come back, this is what you'll do. So your first time on the ice, you'll go out just in your tracksuit, just skating, no up and down, no, you know, fancy stuff, just going for a skate, a little bit of forward skating, a little bit of backward skating, maybe some like bilateral, like really gentle as you're coasting, C-cuts forward and back. But that's it. You'll be out on the ice maybe like 15 minutes, because sometimes it feels fine while you're doing it, and then later on it's like, oh, it'll swell, it'll be painful, and you know you've overdone it. So we always want to, or my approach was always, I always want to do sort of the minimal amount, so that then I know, hey, if that knee gets really irritated and swollen after doing just that, that was too much. When goalies go out and they do this and that, oh, and then that felt good, and then I did some of this and some of that, and oh, and then today it's really sore. Okay, I don't know now, was that basic level okay, but this add-on stuff wasn't? You know, I don't know where the load tolerance is. So let's assume you do that, everything's fine. Then the next time you're out on the ice, and it could be the next day if it feels fine, then you're going to go out with your gear on, and you're just going to skate, you know, just from your skates, almost the exact same thing you did the day before, just wearing your gear. There's going to be no transition up and down. It's actually going to be no work from your butterfly, because that position is going to be really hard on that ligament. So again, we're just testing. Can I skate in my equipment without pain or irritating my knee? Perfect. If that goes well, then the next day you can go back on the ice with your equipment and do some controlled drills from your skates. You know, maybe some T pushes, some C cuts gently. Then you can go to your butterfly and you can do some, you know, butterfly pushes, but again, not game speed, just testing the pattern, going into the RVH a little bit. How does that feel going into and out of those positions? Not transitioning. So I'm either doing drills from my skates or I'm doing drills from my butterfly, but I'm not transitioning. If that all feels good, then we're almost getting there. Then you're going to add in some transitions. You're going to add in some drills, so where, you know, there's a predetermined pattern, but it's going to be mixing up movement patterns. So maybe it's like starting at your post, T-push to the top of the crease, T-push back to your post, come down into your RVH on the opposite post, and then recover back, T-push to the top of your crease. Something like that, that's predictable, but is going to include different movement patterns. If that feels good, then we start adding in some predictable drills, with some shots, some saves. That could even be the same day. The next day, maybe you're going to red shirt practice, just predictable drills, getting in there a little bit, and then if that all feels good, you know, it would be a return to practice, and then you'll see how you feel return to games. And it's a pretty long process because it actually is a pretty serious injury, and you want to make sure that you're taking all the right steps so that you just have to rehab it once. It's not something that's going to come back to you. It's not something that you're going to hurt again and damage worse. Plus, you're not going to put yourself at risk of some other kind of injury because you're compensating for that lack of mobility, strength, stability, or just trust in your knee that you injured. I'll hit you with a little bonus tip. as I like to do from time to time. And that is that a neoprene sleeve. So, some of them have metal stays in them, and you decide what's going to feel the best to you. But I think even just having the sleeve, the contact of that sleeve with your skin sort of enhances your body's proprioceptive input. It gives your brain, the sleeve interfacing with your skin kind of gives your brain a little more information about the position of the joint, the twist in the joint, and I think that can help your muscles do a little better job of stabilizing it. So that's something to keep in mind, and it's pretty thin. You can wear it underneath your gear. The take-home point from this, I've given you a lot of exercises and progressions, but the take-home point is if you want to do the very best thing for your knee so that you can come back as quickly as possible with as few complications, because sometimes too the mechanism where you injure your MCL, you can also pinch your lateral meniscus or, damage some other structures. So the best way to get back on the ice as quickly and safely as possible is to work with a really good sport physical therapist. Sooner or later, we all need one. So we need to, may as well start now developing a relationship and finding one that we trust. If you go to the sport physical therapist and you're there for 3 weeks and all they're doing is ultrasound and hooking you up to the interferential current or the electrodes, find yourself a new sport physical therapist because you're not getting the kind of treatment that you need. So if you are like, okay, that's great for the MCL, but what do I do if I just strain my groin? I already did a video on that. I'll post a link somewhere, maybe here or here. I'll post a link somewhere so that you can check that out. And I'm really sorry that you strained your groin. That sucks. But otherwise, I think probably it's time to hit the like button if you haven't done that already. You probably did that already. Subscribe, hit the bell. If there are any other injuries that, you've had or that are common, just put it in the comments below. I can make a video about that. My first answer is always going to be, though, get a good sport physical therapist to check it out for you. In the meantime, why don't you get out there and stop some pucks?